to the main lecture proper, I would like to teach you how to compute for the age of gestation as well as the expected date of confinement of a pregnant woman. Okay, a patient will come to you as a doctor or the clerk or the intern in charge at the outpatient department or the labor room with of having some difficult of urination while pregnant. Okay, and she will give you history. When you get into clerkship and internship, you have to note for the last menstrual period. That's always yan sa prenatal, no? You have to take note. Kailan yung last menstruation? That means the first day of the last menstrual period. So let's say nagka-mens siya last July, then what day of July? Okay, so to give a specific example, let's say the last menstrual period is July 10 of okay? So we compute for the age of gestation until now. Ano pitsa yan na? October 23, okay? So you have to count the number of days from July 10 to October 23. I think you have to have a ball pen and a piece of paper or a calculator. So I would like to ask, how many days are there now from July 10 to October 23? Miss Rueda. Ilang days yun? Can you count from July 10 to October 23? Kasi yan yung age ng baby ngayon, age of gestation. So you have to add, there are, di ba sa July, you have 31 days in July, then you count 21 na lang siya remaining, di ba? You have 21 days in July, you have 31 days in August, you have 30 days in September, and 23 yan na, okay? So you count 21 plus 31 plus 30 plus 23. You understand? Since July 10 until now, pira na kadlaw. So you will count. Ha July pala 20 days na. In August, you have 31. And for September, 30. And October, 23. So that's how many days? Okay. Huh?
It's 100
How many days?
105 days po.
Can you speak louder, please?
It's 105 days po, Doc.
105. Okay, let me see.
Yeah, from July
4,
21
5, 6,
to
7.
October 23.
Okay, yeah. 5 plus 5. 105 days, correct. So that means you have 105 days. But usually the answer should be in number of weeks. So you divide the 105 by 7 to get the number of weeks. So you will have
15 weeks, Doc.
15 weeks, Doc.
15 weeks.
15.
15 weeks.
Exactly. Okay. So you have, the answer should be 15 weeks. Okay. But you know, kung, let's say, nag-ano to ya, July, let's say July 7, so it would be different. You will have 15 weeks and 3 days like that. Huh? For this example I gave you, it will give you an exact 15 weeks. Okay. So correct ka yan. And how will you compute for the expected date of confinement? So, alam nyo na how to compute before we go to the EDC. Age of gestation, you know how to compute. You just add the number from the last menstrual period and to today. Hanggang sa ngayon. So, you add them up and you get the number of days, divide by 7. That's how to get the age of gestation and number of weeks. What about for the expected date of confinement? You just add 9 months and 7 days. Okay, so for this one, July 10, 2020. So ano yung expected date?
April 17.
Ilasyon. Ha? April?
17.
Next. 2020? 2020 ba?
2021.
Correct. You add 1
April
year,
7.
huh? So April 17, 2021.
21.
Huh?
Yeah.
That's how to get the right answer. Just I add 9 months plus 7 days. But when you get to, clerkship, and mas madali ang subtract na lang 3 months. Okay, so July is 7, di ba? Minus 3. So 4, which is April. But then you add 7 and then 1 year. Okay? Mas mabilis. Okay? When you get to practice this, when you get to OB, practice kayo parati ng plus 9 months or 7 days, you will really master how to compute the expected date of confinement. Okay? So alam nyo na, Miss Casano, alam mo na how to compute? Okay, di ba? Madali lang. So, when you get to clerkship, don't tell the doctor there at ABRMC na hindi ko kayo tinuruan, ha? You should master this age of gestation and expected date of confinement. And again, when you get to 4th year, you will have the revalida. You will be asked again about this. Okay? So, we'll now start with the talk about the extra embryonic membranes. There are 4 extra embryonic membranes. We have the amnion, we have the chorion, allantois, and the yolk sac. I will not talk about the chorion because this is part of the talk about this later, no? The chorion is the first to appear, but it is part of the placenta. It is the one that is anchored in the uterus. So nasa part siya ng uterus and part of the placenta. So that's the chorion. Now, today we'll discuss about the amnion. Okay, ano ba yung amnion? Have you heard about the amniotic fluid? Okay, so the amniotic fluid is produced by the amniotic cells. Ano ba yan? Ano, kadiri na move. Okay. The amnion is the membrane around the fetus. So, imagine the fetus inside the mother's womb. There's a fluid that the baby. It is inside the amniotic sac. Okay, it's inside the sac and it protects the baby. Kahit there's outside, suntok ko niya ti asawa. Thank goodness there is an amniotic fluid. Bisan niya suntok ko ni ti asawa, hayati yan. They will not be hurt so much because there is an amniotic fluid. Okay, and in the United States of America, there's such thing as bisan na din amniocentesis, no? Which is done transabdominally to aspirate the amniotic fluid from the amniotic sac. And it is where you have studies of the genes, genetic materials inside the mother's womb. Okay, and it's not allowed here in the Philippines, but they test on the baby, on the genes, and when they do see that there is something wrong with the baby, they opt for adoption. Abortion. Nagkikita pala kaninahan koan, Trump versus Biden. There's Democrats, they allow, we call the abortion, but for Republicans, they do not allow abortion. Right, like here in the Philippines, because Catholic country, we don't allow abortion. So usually this amniocentesis is not done just so to carry out an abortion. Okay. The amnion's epithelial cells have the so-called microvilli, which may play a role in fluid transfer. Okay. Anong gamit kining what is the amniotic fluid? Fluid is initially secreted by the amniotic cells, but most of this would come from the maternal blood. Now, usually in the late months of pregnancy, the fluid, which is called the amniotic fluid, will also have contribution from the urine of the fetus. Huh? So hindi lang talaga amniotic sac yung nag-produce amniotic cells, but also the urine of the fetus will contribute to the amount of amniotic fluid. That's why in fetuses or in pregnancy where there is malproduction, guti ay la, no? There is minimal production of the amniotic fluid, there must be something wrong with the kidney of that fetus. Huh? So sometimes hindi maganda yung kidney ng, that's why it does not able to put out urine. So nagguti ay light ay amniotic fluid. The kidney must produce enough fluid to contribute to the amniotic fluid. So by of the liters of the fetal urine, 1/2 liter rather of fetal urine is added daily. So importante talaga the status of the kidneys of that fetus to be able to add to the amniotic fluid. The volume of the fluid increases 30 ml per week to 350 ml by the 20 weeks of pregnancy, and about 1,000 ml by the 36 weeks of pregnancy or beyond, no? And it will decrease after that. There is oligohydramnios, meaning low volume of urine. When there's low volume of the amniotic fluid, no, it is called oligohydramnios. Okay, and there's insufficiency of production of the fluid, or the baby failed to contribute much to the fluid. Okay, we call this oligohydramnios. That's why when there is oligohydramnios, we usually seek for answers why the woman is having oligohydramnios rather. Amount of amniotic fluid, and the baby must have some defects in his kidneys or defect in the cells that produce the amniotic fluid. And what is the impact of having very little or minimal amount of amniotic fluid? What do you think? Now, since it is the protect the baby from outside forces and will allow the baby to grow, okay? Itong baby, okay? So the baby will have some fractures later, no? Fracture because it cannot move. It will have to stay in that position for so long because wala naman tubig, wala hiya kagigiusan, no? He cannot move big, and so the baby might just die. Okay, there will be malformations in the baby, and the baby will have a fetal demise. So it is said that the water in the amniotic fluid changes every 3 hours. The fluid is normally swallowed by the fetus up to 400 ml near term and is absorbed in the circulation by the fetal gastrointestinal tract. What is the composition of this fluid? It is really suspension consisting of desquamated fetal epithelial cells and equal parts and inorganic salts in 98 to 99% of water. So mostly water, and 1% of this will be your desquamated fetal epithelial cells. Now, before this lecture kanina, no, a while ago, I said about the significance of the fluid. Can we, just to let you remember, Ira, what is the significance clinically of your amniotic fluid? Nag-mention ako kanina.
Hello, Doc.
Yes.
Can you hear me?
What? Yes, I can hear you well.
For protection po of the fetus.
Yes, it is for protection of the fetus. How? It cautions the fetus or the embryo from some trauma. I said kanina, kung susunto ko niya, the woman is maltreated by the husband, the baby will not be traumatized very severely because there's some fluid. Or if the mother will have an accident, a car accident, so the fluid will be able to protect that baby. Okay, and it will also the fetus. It will allow the fetus to move freely, aiding in the skeletal-muscular development. It for the symmetric external growth of the embryo. And yan yung 5. It prevents adherence to the amnion and to the uterus as well. Okay, so just imagine the fetus without the fluid. The fetus will adhere to the amnion and to the uterus. It will not be growing. Kaya wala, there's no room for growth. Kaya magkukulaps man uterus. What makes the uterus, its shape will be the amniotic sac as well as the fetus. Pag waray na tubig, so that fetus will just adhere to the amnion and to the uterus. Okay? So this is, we have an exact amount of amniotic fluid during the pregnancy of a woman. May daliwan, amniotic fluid is more than 2 liters. This is called polyhydramnios. And this is not well of the pregnancy because polyhydramnios may also be a defect in the gastrointestinal tract of the fetus. Diba? Dapat swallow, the fetus will have to swallow the amniotic fluid. But if it fails to swallow, that amount of fluid will just increase and increase and increase. It will produce polyhydramnios. So what are the malformations in the fetus that will produce a lot of amniotic fluid? Hindi yan nakakaswallow. So anything that will produce atrophy of the gastrointestinal tract. Huh? So esophageal atrophy will cause this one. Okay, hindi siya makaswallow. The fetus cannot swallow the amniotic fluid, so it will not diminish in amount. It will just grow and grow and grow in amount. Okay, increase in amounts rather. Whereas kung hamubuliwat ng amniotic fluid, then there must be something wrong with the fetal knee because it cannot contribute to the amount of amniotic fluid. So that was all for the the amnion rather. So the amnion, amniotic cells will produce the amniotic fluid. Okay, and that's one of the extra membranes. Now, before we go, I was talking to you about the embryonic pole and the extra embryonic membrane, right? So we are talking now about the extra embryonic part of the products of conception. Kasi yung embryo, the fetus and the whole thing, no? But the cells outside of the fetus or the tissues outside the fetus are called the extra embryonic membrane. So one of these is the amnion that we have taken out. The chorion, I will not talk about this afternoon. The next is the so-called Allantois. Ano naman ito nga Allantois, no? This just for theory lang, no? Because the Allantois in your adult in gross anatomy, no? The Allantois becomes the urachus or the median umbilical ligament in your cadaver. Your cadaver, you have to look up the so-called the median umbilical ligament. Because after birth, this Allantois, the urachus, urachus. In the Allantois, the blood formation occurs in its walls during the 3rd to 5th week of its blood vessels. and its blood vessels rather become the umbilical arteries and vein. So that's the importance of the Allantois in the formation of blood. And as I've said, after birth, it becomes the urachus, no? It is an intra-embryonic portion running through the umbilicus to the urinary bladder. Urachus becoming the median umbilical ligament. So here it says it runs into the umbilicus to the urinary bladder, and it after birth. And then in the adult, it becomes the median umbilical ligament. That's what you will see in your cadaver. In real life, no? So talk about the amnion. Next is the Allantois, and the next one is this is one of the extra embryonic membrane. So what is the importance of having the yolk sac in the extra embryonic membrane? It is not a yolk storage site in the human, but in the embryo, it plays a role in the transfer of nutrients. Transfer of nutrients on weeks 3 to 5. Can you still hear me? It's raining hard. Can you hear?
Yes,
Yes,
Doc.
Doc.
Okay. Okay, maura man din duro. Oh. Okay, so okay, there is a blood development occurring in its walls on weeks 3 to 5. Okay, and during week 4, its dorsal part is incorporated in the entodermal tube. And it also forms a primordial germ cells on its yolk sac, no, during week 3. Okay, so the primordial germ cells will initially come from the yolk sac before it goes to the ovaries, testes in the males. Okay, what is the fate of the yolk sac? Now, this yolk sac will have a yolk stalk. Okay, may they a stalk, no? And it is said that during adult life, the stalk becomes a diverticulum. Diverticulum yan, nagiging isang tube, no? In the adult yolk sac, the yolk stalk rather. There's a stalk that bagayan may stem, no? That connects with the yolk sac. And during adult life, it becomes a diverticulum. And this diverticulum becomes infected, Dana. It becomes infected and it will mimic an acute appendicitis. Okay? Now, there's a such term as acute diverticulitis in the adult. Okay? And a person which has acute infection of this diverticulum, which is the yolk stalk, okay, will mimic the symptoms of an appendicitis, okay, acute appendicitis. So there were many times before in my training as a clerk or an intern, and we went into the operating room thinking that the had an acute appendicitis. And when we opened up the patient, or the resident or the surgeon opened up the patient, it was not an acute appendicitis, but an acute diverticulitis. So an area diverticulum which came from the yolk stalk became infected and mimics, or it mimics, or the symptoms were the same with acute appendicitis. So actually, it was not acute appendicitis, but acute diverticulitis. Okay, so you can mistook the acute diverticulitis to that of an acute appendicitis. So amo kaya itong importance of having to know all these uh, structures that are part of the extra embryonic membranes. So to recap, the extra embryonic membrane, number one is chorion. Chorion, which is the first to appear, and it's part of the placenta. Next is the Yolk Sac. Number three is the Allantois, and number four is the Yolk Sac. So that is it. The extra embryonic membrane. There's one other structure that I have to discuss because it's not one part, not part really of the extra embryonic membrane, but it is discussed with this. It is called the the umbilical cord. Okay. So I guess you have seen the umbilical cord in the newborn. Mr. Elacion, nurse kanto? Mr. Elacion?
Hello, Doc.
Yeah, nurse,
Hello po,
are you
Doc.
a nurse? Huh? No?
Medtech, Doc.
Medtech. Okay.
Medtech.
Ano, di ka kanundog. Okay, medtech. Okay. Have you seen an umbilical cord?
Not yet, Doc. Waray pa.
Waray pa. Ano, hinubat nurse hindi? Kaliwat ako, correct didi ko. Correct didi, ano. Pakoma? Ariel, nurse kanto?
Direct, no, Doc. BS Bio po.
Okay. Abis Bayo. Okay. Hindi naman to nurse. Anyone? Raise your hand. Hello, nurse. I think you have seen.
May plus points ka, no?
Five. Raise. Huh? Okay. Cord, and you know it connects the baby to the placenta. Okay. And this umbilical cord is very important because it will bring from the placenta to the fetus. Okay? And through the umbilical cord or through the umbilicus, there are two arteries vein. Okay? So this is why, just to connect you clinically, after the baby is born, di ba, inka-clamp naton, duhang nga clamp, ito nga cord, and you cut through the clamps, okay? And then of course you clean the baby with the kalaba pa nga cord, and then you cut it again at the nursery. And what the doctor does or the nurse does is to inspect the umbilical cord. What is inspected? Ano dapat ang i-inspect natin sa umbilical cord?
Presence
Cherry
of two
and
arteries
cinco.
and one vein.
What do you think?
Yes, Doc.
Yes, anybody?
Presence of two arteries and one
Yes,
vein.
yes. Correct. There should be the presence of two arteries and one vein in the the cross section of that umbilicus. Because if you have inversion, duha na in iya veins, then you must expect some anomalies in the circulatory system. Okay, the heart and circulation. So there must be two arteries and one vein. It's always inspected. Dapat naka-check yan. Two arteries, one vein. Okay? Otherwise, mag-expect kita in anomalies in the cardiovascular system. So, in your histology, cross-section of that umbilicus or the umbilical cord, and it will have much of its tissue, no, the Wharton's jelly. So ito yung 2 arteries and 1 vein should be inside the Wharton's jelly. Ha? So amo ito yan, no? And what is important in the umbilical cord is that you should know the exact length. Okay? When you assist on a, you should always take note of the umbilical cord length. Ang length niya, ha? Kasi too long a cord will produce some anomalies and some accidents in the baby. Too short of the umbilical cord will also produce some accidents. Pregnancy, okay? So what do you think would be this? Kung let's say, imagine, you know, a doctor should be imaginative, ha? Dapat makusog ito yung imagination. Okay, imagine a baby and a cord, 2 centimeters lang, 6 centimeters, ganyan lang. Maliit lang, 6 centimeters lang yung cord niya. What happens? What will happen to the baby? I had a patient. The mother went into the so-called abrupt. The placenta detached early. Kay guti ay lang niya, short cord. So when the baby moves, the placenta will also be, you know, pulled out. So what happened was that when the baby moved, the placenta from its attachment. So mag-bleeding yung mother. And the bleeding was right there inside the uterus. Okay? Or exact, and the mother and the baby could die earlier. Okay? Kaya kita alak ito ng umbilical cord, and the placenta will be avulsed from that uterus, from its attachment. So there is no more blood supply to the baby. Okay? The baby will die instantly. And the mother could also die because she was bleeding and bleeding from the placental side. Okay? And the bleeding is not seen from outside. Remember about the ectopic pregnancy? And you cannot detect it unless the mother has a uterus that's very hard, very stony hard uterus. So you will know nga something must be inside that uterus nga kaya ano nga stony hard man niya. Always in nagkikinontract lahiya. Even diri pa hiya nagle-labor. Okay? So there must be something wrong in uterus that keeps it contracting, and it is the blood inside that uterus. For an avulsion of a placenta, abruptio placenta. Okay? Because of a short cord, di ba? Imagine a short